back. Master the voice, there and low. I want to speak a little bit about the jaw today. Let's talk a bit of jaw. Jaw, when I palpate jaw to take away muscle tension that can come into the jaw and the tongue root and that holds the voice in a tight state, usually caused by grinding our teeth or bruxism. And bruxism events are connected to our sleep. A lot of people clench during the day, but there is grinding and clenching our teeth at night. And I don't think there's really a great understanding of that yet. We can't just say we fixed it with a mouth guard, because when you put a mouth guard in that the dentist has you wear, the mouth guard is protecting the enamel on your teeth, but it isn't stopping you from grinding. So you still grind the guard. And so that develops tongue-jaw tension, and it can create headaches, it can create voice issues. There's a whole myriad of issues that can come from that. But let's just understand the muscles. We're back using our software called Visible Body. Thank you, Visible Body, for this software. It's excellent. This is the jaw muscle called the masseter. Okay, it's big muscle. Boom. It's the big muscle of the jaw. And then this is the deep masseter, and it's underneath there. And if we move those away, then you're going to see the muscles called the pterygoids. And pterygoids are up underneath, actually. If I pick on that, that's the lateral pterygoid. And we'll expand it. I can see my hands not showing you the best view. But the jaw then has two joints. It has a joint back here, and it has a joint up here. And those joints, they hinge. They're condyle joints. They hinge a little bit. They kind of rotate, like in sort of a cup at the top. Here we go. And they kind of rotate like that in those hinges. And these ligaments that you have, they're basically holding everything in. This is a big cheek muscle that also attaches in there. But if we remove the jaw, let's hide the jaw now. Some of these muscles in here, this medial pterygoid, this is quite a muscle, because it goes down and it inserts into the base of your tongue and on the inside of your jawline under here. So oftentimes we target that muscle with palpation underneath the jaw or palpation in the mouth. And it's all to get the jaw to start to relax. So let's put, oh, that's his head. Put his jaw bones back. This muscle is not necessarily jaw based, but some of these muscles under here, they can get, whoa, let's move them down. It can get quite complex in that the muscles that are in here are all connected to voice box. The superior pharyngeal constrictor goes up as the back wall of your throat, and then the middle pharyngeal constrictor, which is in there somewhere down there. Let's find it. Remove the platysma, and there's the middle pharyngeal constrictor. So those are all connected directly to the hyoid bone, and then that's all part of the sling that sits inside the jaw. This guy, this guy, this guy. All muscles that are sitting in that space, okay? So when we talk about jaw, it's not just the bone, obviously. It's the muscles that attach into the jawbone, and it can give pain. It's a really big source of pain for our body. But we show different types of techniques in my clinic to get you rid of like jaw tension. Some people use Botox injections. There's a whole list of things that we can do to treat jaw pain and pain that gives headache, voice problems, a number of those issues that correlate to swallowing. So let's talk jaw. The more questions that I get, the better. And just hit the subscribe button. We'll talk more and more as you guys push in questions. But I really think that we should open up the number of therapists out there that are willing to treat jaw, and then try to structure more home therapy for people that have bruxism and that grind at night. Great. See you soon.